Thank you, Dr. Masood, for giving us your time and, answering, being ready to answer all these questions patiently. So, without wasting much time, I'd like to dive in and start off by asking you that the cases have obviously risen, right? And this time there are a lot of new variants that have also come in that we're hearing about. So, what are the symptoms and how are they different from last time?
Okay, thank you, Simran, for giving me an opportunity to be part of this medical discussion on COVID-19. As we know, we are going through the second wave, and you're right. There are a lot of new variants over here in the current scenario. We have double mutant Indian variant, and we have we have nearly all the strains of the South African variant, the Brazilian variant, as well as the UK variant, which have been, genomic sequence has been done, and we have all the strains over here now. But that is basically important for an academic discussion. But if you come to see the symptoms which people are presenting, they're pretty much the same bunch of symptoms like headache, fever, cough, throat pain, shortness of breath, sometimes loose motions. But this time what we are seeing different is that we are seeing lung involvement much faster. So people are coming in, they are walking in and they do the RT-PCR, which is negative, but they have all symptoms there. Such. So, but what we are seeing now is that in the earlier variant, we are seeing that the lungs, the pneumonia component would come in much later on. Say after about 4 to 5 days of the incubation period being over. After they are positive, 4 to 5 days later, they would have lung symptoms. But now, simultaneously, or even before the RT-PCR being positive, we are seeing on the CT scan lung shadows, which indicate typical COVID pneumonitis, that is pneumonia involvement.
Oh, okay. So this is the first thing that I'm hearing, which has changed, right? So what factors do you think are sort of playing a role in making this infection be this severe?
See, this time we are seeing more and more young people being infected. To a certain extent, it has very less to do with the virus, but because of the behavioral pattern of young people. They are going out more, they are going to crowded places, traveling, public transport. All these factors are bringing in many more younger patients sick to the hospital. But no doubt, the same factors which predispose one for serious infection, like diabetes, hypertension, morbid obesity, smoking, chronic liver disease, chronic kidney disease, chronic lung disease, immunocompromised conditions like autoimmune diseases, cancer patients, people on chemotherapy, all these people with comorbid conditions are much vulnerable. And these are more seen in the elderly population. So this is what we are seeing. Yes, we are not seeing many cases in the pediatric age group. So that is a big blessing, I would say.
Correct. Yeah, because there's already so much, and to deal with the age, I think becomes obviously something that we need to think of, right? Because like you said, a lot of people are going out, and I think that's where the cases start spiking up post the lockdown, where it was sort of like a very lenient attitude that the public generally had. So I think with this, because we cannot stop going out, obviously with maintaining social distance, you have to sort of go out. So how can you sort of curb this virus? Like, what are the ways according to you in which we can curb the virus?
Well, if you look historically, viruses and pandemics have very strong patterns. Wherein, see, we are only thinking about mutations which are more dangerous. There are mutations and the virus becomes weak also by various medications that we're using and over a period of time. So, but at this time, it is ruling the roost. And the way we can curb it, the way we can control this is it's only with it in our hand. We have to follow certain methods, certain precautions have to be taken. Most important is facial barriers. Mask is very important. You have to wear an appropriate mask and wear it appropriately, not below the nose, not on your chin, but it has to be from the face. And it has to be a proper face mask, at least triple layer mask with the nose pin and a proper fit. It is very, very appropriate. That if everyone wears a mask, if I am the infected person and I'm wearing a mask, I am reducing the viral burden in the air because it's getting contained inside the mask. And if there's an opposite person over here, he's wearing a mask, he is not inhaling a very high viral load. So the body is able to take care of very small viral load which is inhaled. So if we reduce the burden in the environment, then definitely it will help. And the only possibility is with wearing facial masks. Social distancing is a tough concept, and I think, in my opinion, it's a failed concept. I don't see anywhere social distancing being successful. At least in our country, it is not possible because you need a very high civic standards in the population to be able for this social distancing to be successful.
Right.
You need individual responsibility, individual people responsible that they themselves maintain it. Nobody can go every place and make ensure that people are following social distancing. The other thing is you have to make sure that you avoid crowded places as much as possible. Marriages, religious congregations, going out to dine in crowded places, in indoor spaces. These all have to be avoided at this time. Right. Because you have to take care of yourself and your loved ones. That's the only method to curb at this time. Right. This is preventative. That's the only method. There is no shortcut to this.
Right. So according to you, because obviously, like you said, there's a rise in the cases with, all of this that's happening, the social distancing concept is not something that India can sort of apply right now. Do you think having a lockdown would change anything?
Well, Simran, it is a very, very interesting, we can debate for hours on this. Mm-hmm. In my strong opinion, we know that our resources are limited. We have limited finite number of doctors, finite number of hospital beds. We have finite number of oxygen production. We have finite number of medication production.
Right.
No country can say that they will not face shortage in this situation. We are only seeing cases go up and up and up. Right. There are certain definite patterns in which the cases are going up. Why they are, we know that. It's because we are trying to keep the economy going. We are trying to keep the city running, and people are going out to work. People, have no other choice. And we are seeing them getting more and more infected. More people are coming in. Unfortunately, we don't have, the system is getting overwhelmed and it's going to crash. Right. So how do we prevent this? The only way we prevent is stricter and stricter and stricter restrictions. I'm glad the government has come up with some strict restrictions, but we citizens have a responsibility to follow these restrictions. Yes, at a certain point in time, I think lockdown may become essential. Mm-hmm. I feel it is essential now, at least to give respite to the healthcare facilities, to make sure that we have enough stockpiles of medicines, we have enough oxygen supply. Today, what we are seeing, deaths are because people are not able to get enough oxygen. We are seeing every day, it's reported, they're not able to get a bed in the hospital.
Correct.
We in the hospital, the nurses are getting sick, the doctors are getting sick. So we are getting overwhelmed.
Right.
So even though we don't like it, see, life has to be preserved. That's a paramount. You can always revive an economy. You can always revive. Money is an artificial creation, but not life.
That's a very good thought. In fact, like, my next question was going to be that there are shortages of bed, ventilators, oxygens everywhere, right? We see that happening in every city right now. And the system, how much can it help, is one thing that we would obviously ask, because it's on them. But like you also said, the onus comes on us individually also, as to how we react to the situation, how much of precautions we're taking. But all said and done, I want to go back to the same thing and ask you that how much can the system actually help in a situation like this?
Well, I think so. It's the system, because this is a systemic problem. We want to kind of isolate this, insulate the system.
Right.
But to tell you frankly, in a pandemic, it is not. We cannot. The policy is formed by the system, whether it's the state government or the central government. So if I want to restrict oxygen supply to industry, other than medical industry, that has to be a regulation by the government. The capability is only with them.
Right.
No individual hospital or no individual person or a group of people in the private sector can do that. Right. Those kind of decision making is only, and enforcement is only possible with the, I think the policies are very important in a pandemic. The policy of how do we manage the medication? Do we maintain enough stockpile before we start exporting it? Do we maintain enough vaccination supply? How can we do? Is our domestic production sufficient to maintain, to vaccinate our people? Or do we need help from other suppliers? Right. India has a huge pharma industry. If we, at some point of time, we have enough capability to serve the entire world, and we'll be doing that. And we can retrofit to manufacture medications. We can bring in ordinances to dilute the patents and make sure that more people manufacture in this disaster situation. So all this can be done only by the system.
Correct.
Then availability of bed. Creating COVID centers is not possible. In a small way we can do that, but in a large setup for the entire city, it's only can be done by the government. So we have to go back to the system and create policies which will help us in bringing some kind of relief for this situation.
Right. So do you think, because we're coming back to the entire thing of what exactly can the system provide and what exactly they've been doing in the last year, coming to that now, the vaccination is being provided for, people above the age of 18. Do you think that would make the situation any better?
Yes, absolutely. Vaccination for everyone who is eligible, who is going out of the house. Yes, we did the right thing. We had, as the supplies came in, we gave the enough opportunity for frontline workers, healthcare workers. Then came the senior citizens and people with comorbidities beyond a certain age, and then people above a certain age. It has all been going fine. Now I think so. It's the right time to open up to everyone who is eligible and who is willing to take a vaccine. Every vaccination, every injection that goes into an arm, we are moving one step closer to getting towards herd immunity. We need 70% of the population vaccinated for herd immunity. It is a long shot. It will probably take 2 to 3 years for that to happen. With the current supply of vaccination, of only injectable vaccination, probably this timeline will shorten if we have successful nasal vaccination program too. So let's hope for the best. And yes, it is a good step going forward. And we should, I honestly feel, government has many other things to do. It should open up commercial vaccine, of not just Sputnik, as they have given permission, but other Pfizer, Moderna. They would definitely, they are enough and more number of people, even if it is 10% of the population who would want to pay and get vaccinated, I think so they should be given the choice to do that.
Right. I completely agree with that too, sir. But coming to my next question, which is, a little slightly away from the pandemic situation, but also something that we need to focus on because it's affected everyone, the lockdown, or whether it was just dealing with the pandemic in a different way. I think it's very personal as to how people have dealt with it, right? And coming to that, I think mental health generally is a taboo in our country. We don't see people speaking about it as much as we're actually supposed to. So, and the need for it is now more than ever, right? Because people are dealing with so many things at once. So, what do you think are the different ways that we can reach out for help in a situation like this, especially for mental and emotional stability?
Fantastic question. This is a very, very important aspect. It's affecting each and every one. Life as we knew has changed from March 2020. Um, it is a pressure cooker situation for nearly everyone. The children at home, for adults, for elderly, everyone. Life till February of 2020 was unrestricted. There was everyone was doing whatever they felt like. There were no restrictions. But now, there is a sense of fear. There is everywhere you go. There's a sense of fear, and this causes a lot of stress, depression, anxiety, psychosis. These are all on the rise.
Right.
Yes, it is a taboo saying that to yes, I'm scared, to yes, I am feeling anxious. We don't accept this.
Yeah.
We are very, very worried and concerned in accepting these kind of psychological trauma that we are facing on a day-to-day basis. I feel each one have to become a mentor and a support system for the other in the family. Whether if you're the head of the family, you need to reassure them. Yes, we are in a tough situation. You need to talk about it. You cannot, sweep this below the carpet. These are certain things which you sit down and explain even to small children that yes, it is difficult. We don't want you to go out. We don't want you to go out without mask. The reason we have to explain, kids are smart nowadays. They have information. We need to reassure them that things will be fine and we will be taking care of them. We have to do that.
So, sir, you've already seen that there's so much fake news and videos and so many things that are just, on the internet, WhatsApp forwards that we keep getting about like new symptoms or just basically different experiences about people. Do you think that this may have affected in the way, a lot of us would have perceived the virus, even initially or now?
Yes, I think so. This is a very, very relevant question. Today, there's a lot of misinformation. That's the reason people are not seeking care at the earliest. There's a lot of misinformation of what goes on in a hospital and related to COVID. Some say it is just a regular flu. Some feel that it is a conspiracy, but nothing. It's become so easy nowadays to spread information. There's nobody consumes information without even verifying the authenticity of the information. It's so easy to create any information and put it out there in social media, and people look at it. We are very gullible, a lot of people, and we just see whatever comes in WhatsApp, we accept it at face value. But that's not so, and that has led to a lot of misinformation. People don't come on time, they don't get vaccinated. This is definitely an issue with today's social media. The reality is that it's pretty safe. With following certain protocol and then maintaining urgency in getting treatment will help you. Time is of the essence in COVID. Will help you get better and faster. You have to consult a doctor, home isolate, and you will be fine. So do not be scared of this. And awareness and information, the right information will only help you get better faster.
Yeah, so think just like you said, not taking stuff at face value, verifying it and figuring out that is this the right thing, and do we need to sort of consult someone? At the end of the day, you guys are professionals, so reaching out to someone who knows this best is the only way to go ahead. And that brings me to my next question, which is, like you said, life did change post March 2020, right? But the frontline workers, all of y'all saw it firsthand. You guys saw what was happening on ground while most of us were locked down at home. So I want to ask you, which is something, it's a sort of like a personal question also, maybe, one experience throughout this entire year that probably shook you personally in your profession.
Well, there are many incidents that have happened. It's given us a lifetime of memories. I would say more than memories, a lot of horror stories, and I just hope we do not see this once again. We more than anyone else are waiting for this to get over at the earliest. We've seen many. One which we really shakes you up at the core is a very a 35-year-old lady walked into the hospital. This is during the first wave. In September, she walked into the hospital sick, with shortness of breath, and carrying a small child.
Mhm.
The child, ultimately, we ended up taking care of the baby and the mother. The mother died.
Mhm.
There was no information on who is the next of kin of the child. The child also was positive, but did well.
Right.
Finally, after a lot of, it was 4 5 days of horror, because the child, which was about 4 years old, that had no one. He did not know that his mother has passed away.
Yeah.
She was in the ICU. He was in the pediatric ward, and it was heart wrenching.
I can imagine.
Till some the next of kin came up and took care of the child. Uh, that's one thing which really touched me a lot.
Right. Yeah, I mean, I can imagine. And I mean, there's so many stories, like you said, that would probably haunt you all, right, for the rest of your lives, because there's so much that's happened. And erasing that, I think, will take a while to just go back into the normalcy, because we will question what is normal again. Because right after the first wave, we were thinking that this is the new normal, there's a new way of living through post corona. But yeah, I think it's just the only way ahead is probably hoping for a better future, because hope is all that we've got, right? So with that, I'd like to conclude by also asking you if you have any remarks to sort of make on this discussion, or if you have any message for the general public. What would you like to say?
You see, one message for the general public is these are tough times. We all have to wait this out, and with everyone's cooperation, we will be able to get out of this faster and sooner. But for that, everyone should cooperate. Everyone should follow certain protocols. Facial barrier by wearing a mask in the right manner is important. Try to avoid places in this situation, which are crowded, is again a very, very paramount thing. Wherever you can maintain social distancing, please do so. And stay safe, take care of your health, exercise, eat well, balanced diet, avoid vices like smoking and drinking at this time. Give attention to your own self. And in that way, you can take care of yourself as well as your loved ones. So stay safe, stay home for now, and we will get through this. I'm sure about that.
Hopefully. Thank you, Dr. Masood. Honestly, this was super, informative. I hope everyone got to learn a little bit from your experience as well, to figure out like what we can do at a time like this, and how exactly is the way ahead, like I said, into the future. So I think it's just through the hope and believing that we can get through this, because all of us are in it together. But you've given us enough points to sort of make sure that we can do this in a systematic way. So again, thank you for being a part of this discussion and making this happen for us.